Pittsburgh City Commissioner Dan Roebuck, and I'm here once again on the third episode of our special on the coronavirus. And we are joined here with Dr. Berger, who is the COO and Interim Chief Medical Officer with UF Health Central Florida. Thank you for coming back again with us, Dr. Berger, and I was hoping we could get another update on where things stand with the coronavirus.
Well, thanks a lot, Dan, and it's great to see you again, and I appreciate being able to share some of the updates on what's going on with COVID-19, especially in our community.
So as I understand it, it's mostly good news. Things have certainly improved since where they were last time we spoke. How many cases do we have in Lake and Sumter County right now?
So total since the beginning of March, we have about 279 cases. And over the last 7 days, there's been 16 cases. 8 of those cases are actually in one of our long-term nursing homes. So really only 8 cases in the community.
Wow, that's really great. And I've seen that at least on the state's testing database, it seems that our percent positive is well under 1%. And why do you think that the numbers are so good here in Lake and Sumter County?
So it's hard to know exactly, but it's probably a combination of factors. First of all, we live in a community where the population density is a lot less than other places, especially places like Miami, Fort Lauderdale, Tampa, that have seen more cases in this state, and certainly New York, which was one of the hardest hit areas in the world, has very high population density. So I think that helps us. The other thing is that the weather has been postulated as being a factor in that warmer climates and potentially more humid climates are seeing less cases, but it's hard to really make out the data from that. Additionally, very early on, I think the governor had a good plan in place to implement social distancing, stay at home, and really only essential workers were heading to work. And most importantly, what the governor did was he really protected our most vulnerable, and those are the people who are living in long-term care facilities, group homes, especially in nursing homes. So it's a combination of things, and it's hard to pinpoint any one thing that contributed to the relatively low numbers in our community. So I think it's all of those put together.
Okay, so a combination approach that makes a lot of sense. Now, I've heard people telling me that the CDC's changed their guidance on disinfecting surfaces, and I know in my office I'm still wiping down everything daily with my Lysol wipes. Am I crazy? Should I not be doing that?
So it was interesting. In late last week, CDC came out and said can't spread on surfaces, and everyone was going, "Hey, great news! We don't have to wipe everything down." But then this week, they've changed their guidance and said potentially can spread from surfaces. So I think the thing to do is remain vigilant and conservative and continue to wipe down our surfaces, especially in places where we're interacting with multiple people out in the public, and especially businesses should be frequently cleaning places. My wife went back to the gym. She went to Orange Theory, and they are really doing a great job in terms of cleaning surfaces. Each person who's on the various different devices there, the treadmills, etc., has to wipe down before and after, and then they close the place and actually have additional sanitizing. So I think that's going to be a key, being able to open up and get back to normal, is to continue to disinfect our surfaces. So you always got to be careful when something new comes out to make sure it's validated, but it looks like they are still recommending keeping our surfaces clean as much as possible.
Okay, the last time we talked, the common symptoms were kind of like those of the flu, fever, sore throat, cough. Are those still the same? Are there any new symptoms that we need to know about?
So I think last time I went through all the possible areas that can be affected by COVID, and certainly in some people they've seen that it is multi-organ. It can affect the gastrointestinal tract, the stomach, and the intestines. It can also affect eyes. People have seen rashes in different places. The bloodstream can be affected. So really, any symptoms or any place of the body can be associated with COVID-19, but you've named the most common symptoms. It's really headache, fever, sore throat, cough. Those are the principal symptoms, and those are the really ones that should drive people to get tested. But certainly, if you have unusual symptoms that can't be otherwise explained, it's worth getting tested for COVID-19 as well.
So speaking of testing, I know Lake County's been offering blood tests for asymptomatic people, the antibody test. What are your opinions on those? Are they accurate?
So I think there needs to be a lot of caution with the antibody testing. There was a recent publication that came out within the last couple of days that said they're only 50% accurate, the antibody testing. And in our area specifically, with the low rate of infection, it's highly unlikely that a lot of people are going to have positive antibodies. So the fact that the tests are not very reliable and we don't know what the significance of being antibody positive is, whether it does confer long-term immunity or not, I don't see a real drive to recommending antibody testing. I think the real benefit of it right now is to understand what's going on in our community, see if people have antibodies or are infected, but it's not really capable of driving whether someone can go back to work or not. So I think we have to be careful really recommending widespread antibody testing.
So there seems to be some controversy on masks. Do they work?
So it's unequivocal data that masks can prevent the spread of coronavirus. And that's, if everyone would wear masks, it would dramatically reduce coronavirus. Some estimates up to 85% transmission can be reduced by wearing masks. There are some workspaces where people are completely isolated and not in contact with others. So really the benefit of wearing masks in that situation is probably limited. The other confounding factor that came out recently is that 6 feet distance between people is probably arbitrary. And aerosols and droplets may be able to spread further. So if we're really going to be careful, we should wear masks. It's certainly not feasible in all areas. If we're outside in a remote area and there's no people around, it's hard to advocate wearing masks. And if you're in an office by yourself, like I am now, with no one around, there's no benefit to wearing masks. But if you're in spaces where social distancing is impossible, masks are probably the best preventative for the spread of COVID-19. And certainly people who are in high-risk groups, the elderly, people who have diabetes or high blood pressure, should consider wearing masks if they're going out of their homes and being out in public.
Okay, so masks work. Now, when it comes to this idea of safer at home for seniors, I know everyone's itching to get out. So what are your recommendations on that? Do they still need to stay home all the time, or can we start loosening things up?
So my concern about seniors and telling them safer at home is how long can you do that? And yes, there's risks if they go out in public, but I think there's risks if they stay at home and don't get out at all, right? So one of the issues has been seniors have been afraid to go to see their physicians and go to the hospital if they have issues because of the stay-at-home orders. I think that's problematic because other diseases are still prevalent in the population, and people need to see their healthcare providers. People need to go to the hospital if there are issues. We're seeing people with chest pain and actually late stage heart attacks. We're seeing people with strokes who aren't eligible for treatment since they've waited so long. So I think we have to balance the need for people to get out, socialize, see their physicians, interact with family, and the need to stay at home. If they're going to go out, I think they need to be very careful in that they should be wearing masks. They need to continually wash their hands and keep their hands clean using either soap and water or alcohol-based gels. Additionally, if they're wearing masks, avoid touching their face if they touch other surfaces, and stay away from crowds as much as possible. So be extra vigilant, but after 3 months at home, yes, staying home is the safest thing, but there are other consequences of keeping seniors at home indefinitely. And while there's been great progress over the last few months in terms of vaccine development, potential treatments, we're still not there yet. We don't know how many more months that is going to be. And recommending people stay home until there's a vaccine, I don't think is reasonable.
Well, that makes a lot of sense. I know one thing that I've seen people talking about is this idea of trust circles for those who are the most vulnerable. As they need to get out and socialize, they should be thinking about the people they're socializing and making sure that they've been taking things seriously. Maybe don't socialize with the person who just got off a plane from New York, but instead socialize with people that you know where they've been and know that have been taking this seriously.
And you're absolutely right, Dan. And probably the best thing to do is socialize outdoors, right? You can distance outdoors. And in my community, the other day, I was walking through my neighborhood and there was about 20 people, and senior citizens, but they were all sitting outside. They were all probably about 8 to 10 feet apart. And they were able to interact in a group, but it was done in a very safe manner. Whereas in a confined space, inside, in a restaurant, that's probably a little more challenging and a little more of a risky type behavior.
Well, fortunately, we're here in Florida where it's easy to spend time outside. Now, this idea of a whole second wave in the fall during flu season, what are your thoughts on that? Is there any truth to it?
So that's another one that's really hard to predict. A lot of people are pontificating that as we start opening up our communities, we're going to see spikes. And it's likely in any pandemic that you're going to see potentially waves as things continue to tail off. Can we see another spike in the fall? It's certainly possible, but it's not absolute. And actually, Dr. Fauci was in the news, I believe, this morning, saying that a second wave is possible, but it's not inevitable. And we really need to see what happens. But I think the main thing that we were concerned about when this first hit was having our healthcare system totally overwhelmed by patients. And by flattening the curve, we avoided that, especially in this community. New York had problems, but most of the country did not. So I think we're better prepared if we do see a second wave. I think our PPE, our testing is much better. So if we do see a second wave, I think we'd be better prepared, but it's not inevitable that there's going to be a second wave in the fall. We just have to wait and see and be vigilant and watch the numbers very closely.
So with these low numbers in Lake and Sumter County, both in cases and then percent testing positive, it sounds like it's definitely safe for people to start going back into the hospitals to get treatment they need, elective procedures, go see their doctor. What other steps are you taking at UF Health to kind of make people feel comfortable with the idea that it is safe to go back?
Yeah, so great question, Dan. And right now, I don't think there's any place safer than come into the hospital. First of all, we have no patients in either of the UF Health Central Florida hospitals. So there are no inpatients at Leesburg, and there are no patients inside the villages right now. Despite the fact that we have no patients, we continue to take significant precautions. So we continue to screen everyone as they come into the hospital for COVID. Everyone is masked. We continue to reduce the visitation. We are allowing visitors. However, we have one visitor per patient, and that visitor is screened. All our workers are screened as well. And anyone who's undergoing an elective procedure gets tested before they come into the hospital for their elective procedure. We've tested over 2,000 people since May 4th who were undergoing elective procedures, and zero, not one of those patients has tested positive for COVID. And we're continuing to do that in conjunction with the University of Florida, because that's also what they're doing in their guidance. But we just haven't seen any of our asymptomatic patients coming in for procedures who are positive. So we believe our facilities are extremely safe, and that we're taking really extensive precautions, and people who need to come should come to the hospital or to see their doctor if they need to see their doctor.
That's great to know. I think, really, even though the data says it, hearing the steps so people can become comfortable to take care of themselves is really, really important right now. So I guess just kind of to close up here, as we go through the summer and then into the fall, are there, social distancing, doing activities outdoors, but kind of starting to get on with people's lives as so they're not cooped up at home where we have other issues. Any other just general advice for people as we get through this?
So coronavirus isn't going away tomorrow. We're going to need to learn to live with it for several months until potentially it peters out, which some other coronaviruses have done, or we have really good treatment, or we have an effective vaccine. So we're going to be living with it. I think the thing to do is be careful and vigilant. And the way to do that is if you're going to go out, make sure you're social distancing, wear a mask, unless you're outside in rural areas and you're not encountering other people. Hand hygiene is essential, cleaning surfaces when you're in public places, and seeing your doctor if you do have other medical problems, not ignoring other medical problems because of medical anxiety or fear of seeing your physician because of fear of COVID. So live your life, but extend these precautions while we're dealing with this virus.
Well, thanks. I think that's a really great way to wrap it up. And I'm so glad that we're here talking about coming out the other side with the hospital system in great shape, to the point where people can go back and see their doctors and get their health taken care of. And I think that's because a lot of people here locally did make the hard decisions in March and April and stayed home. And now it's time to start opening back up. And I'm just really happy that we can do that, and we can do that in a responsible way. So thank you again for being here. I really appreciate it. And I would just ask our viewers, to make sure as you're getting information that you get it from a legitimate source. The Florida Department of Health puts out a great dashboard. They update it every day. I believe it's around 11 a.m. with the latest numbers. You can see the numbers for the state, for your county, how many people are being tested, how many were positive, the percent that were positive. Make sure it's real good data and you're not just going off something you saw on Facebook. So with that, I appreciate it. I'm Dan Roebuck, Leesburg City Commissioner, and thank you again, Dr. Berger.
Thank you, Dan. It's been my pleasure.